Any disease they will treat with Deepana Pachana drugs.
ರೋಗ ಬರಬೇಕಾದ್ರೆ ಬರೀ ನಮ್ಮ ದೇಹದ ಸಂಬಂಧಿತ ಕಾರಣಗಳಲ್ಲ.
ಫೋಕಸ್ ಆನ್ ದೋಷಾನುಸಾರ ಚಿಕಿತ್ಸಾ, ವ್ಯಾಧಿ ಪ್ರತ್ಯೇಕ ಚಿಕಿತ್ಸೆ.
ಇದು ತುಂಬ ಕಷ್ಟಕರವಾಗುತ್ತೆ. ಆ್ಯಕ್ಚುಲಿ ಈಗಿನ ಜನ್ರೇಷನ್ ಹೇಗಿದೆ ಅಂದರೆ ನಮ್ಗೆ ಒಂದು ಟ್ಯಾಬ್ಲೆಟ್ ತೊಗೊಂಡು ಬೇಗ ಕ್ವಿಕ್ ಆಗಿ ರಿಲೀಫ್ ಆಗಿಬಿಡಬೇಕು ಅಂತ ಹೇಳ್ತಾರೆ.
Which aspect you think more important for clinical practice?
ನಮ್ಮದು ಪ್ರಾಪರ್ ನಿದ್ದೆ ಆಗಿಲ್ಲ, ಊಟ ಸರಿಯಾಗಿಲ್ಲ. ಸೊ ದಟ್ಸ್ ಬಿಕಾಸ್ ಆಫ್ ದಿಸ್ ಲೈಫ್ ಸ್ಟೈಲ್, ಸ್ಟ್ರೆಸ್ಫುಲ್ ಲೈಫ್.
We know that every science has its own base and own ಸಿದ್ಧಾಂತ.
ಇನ್ನು ಕುಲದೇವರು ನಾವು ಹೇಳ್ತೀವಲ್ಲ, ಕುಲದೇವರು ಅದನ್ನು ಕೆಲವೊಂದು ನಡ್ಕೊಳ್ತಾ ಇದ್ರೆ
ಆಯುರ್ವೇದ ಅಂದರೆ ಪಥ್ಯ
ಜಾಸ್ತಿ ಡೆಪ್ತ್ ಆಗಿ ಓದೋದೇ ಇಲ್ಲ. ಸ್ವಲ್ಪ ವೆನ್ ಐ ಆಮ್ ಸ್ಟಡಿಂಗ್ ಮೈ ಆಯುರ್ವೇದ, nowhere having the belief on Ayurveda. It's very because of exam we are not sleeping throughout the night. ಅವಾಗ
ಆಯುರ್ವೇದವನ್ನು ಮೇನ್ ಸ್ಟ್ರೀಮ್ ಆಫ್ ಮೆಡಿಸಿನ್ ಆಗಿ ನೋಡಿದ್ರೆ ನಿಮ್ಮ ವಿಷನ್ ಏನಿದೆ
ಅದಕ್ಕೆ ಬೇಸಿಕ್ ರೂಟ್ ಕಾಸ್ ಏನಿದೆ ಅಂತ ಕಂಡು ಹಿಡ್ಕೊಂಡು ಅವರು ಟ್ರೀಟ್ಮೆಂಟನ್ನು ಕೊಡ್ತಾ ಹೋದರೆ ಅದು ಇನ್ನೂ ಅಂದರೆ ಇಲ್ಲಿ ನಮ್ದೀಗ ಇಂಡಿಯಾಕ್ಕಷ್ಟೇ ಸೀಮಿತ ಅಲ್ಲ, ಗ್ಲೋಬಲ್ ಲೆವೆಲ್ಗೂ ಮಕ್ಕಳು ಬೆಳೆಸ್ಕೊಂಡು ಹೋಗ್ಬೋದು.
Welcome to the another episode of Talk with Ayurveda. I am Sachin CT. Today we have one more senior Ayurveda faculty. It is my honor pleasure to introduce our chief guest, Dr. Vijayalakshmi ma'am. Ma'am had completed her UG in Mahaganapati Ayurveda Medical College, Dharwad, and she pursued her PG in Panchakarma in SDF Udupi. Ma'am also completed her diploma in the yoga, and ma'am started her career as an assistant professor in DC Gutwal Ayurveda Medical College and Hospital. Then she joined for Ahalya Ayurveda Medical College and Hospital, Kerala, where she served for more than 12 years as a professor, vice principal, and she served as an in-charge principal for 6 months. And she also worked as a RMO in Kottakkal Ayurveda Pharmacy, and she has experience of 17 years. She has presented more than 7 to 8 research papers, and ma'am also actively involved in the SPARK research. It's our honor to welcome our chief guest, Dr. Vijayalakshmi ma'am. Ma'am, please welcome. Ma'am, heartful welcome for our program.
Thank you.
Ma'am, as well known for her teaching skills, her academical practice and everything. Ma'am, before involving to our conversation, just you say, after your second place, how did you get involved into Ayurveda, or who inspired you to pursue Ayurveda degree?
Okay. Good morning everyone. Actually, after PUC second year, so usually from childhood in home we are using many medicines as a home remedies in our family, and again grandma's family, grandmother's family, everywhere they are using some of the home remedies. So by seeing that, again in our near native place, one Annigiri, Gadag one place is there they are using for fractures and all Ayurvedic treatment they are using. By seeing that, again some of the degeneration conditions, chronic disorders, so in our family they took treatment. So by that I was inspired due to that. Okay, I will also go through in the Ayurveda. I will study Ayurveda, and I study in depth in Ayurveda and give the awareness to the people. Thinking of that, I went for the Ayurveda education.
Ma'am, usually we think that college life is a golden hours for every student.
Yeah.
How can you share your wonderful moments or memorable moments in your college life and professional life?
Okay, it's a little bit critical question. So college life usually is a nice usually, and for me again childhood school life is very enjoyable. So we have participated in many other activities, cultural programs, sports and all. College life okay, but we have to study more shlokas and others because it's a basic, it's an ancient science. So we have to study first Ayurveda like in shlokas, we have to understand the shlokas, and then we have to go depth in that. But still, like we are enjoying with the friends, and many other our friends are from North India, Punjab, the Jammu Kashmir, UP, Maharashtra, many students were there. So my classmates, so with them we enjoyed one day trip. We used to go study tour, herbal garden, we used to visit nearby places. Once we came to Moodbidri also to see the herbal garden. So like that, again in that we are in group we enjoyed, and some our senior like doctors were there. So they used to show some of the surgical cases and few Panchakarma treatments, not all the treatments, few treatments I have seen. So in that sense, like we enjoyed that. Professional means after my UG, I went to study, I want to learn more in Ayurveda. I want to practice Ayurveda only. So because of that, I was inspired through my friend. So in Maharashtra, it was very great practice. So I went to Pune. I worked under Dr. Samir Jamdagni, Vaidya Samir Jamdagni. So from there again, I learned many Ayurveda treatments and some preparations also. I learned from there. That is my professional journey starts. So I thought by seeing their practice, so I thought I will practice Ayurveda only.
Ma'am, in Ayurveda we have different principal modality. Like we focus on doshanusara chikitsa, Vyadhi Pratyanika chikitsa, Samanya Vishesh Siddhanta. Which aspect you think more important for clinical practice, ma'am?
In clinical practice, actually I believe mainly I will practice all the three, but mainly we believe on dosha chikitsa, doshanusara chikitsa. Because in our Ayurveda science, everything almost based on it is on doshas, dosha, dhatu, mala we are telling, trayostambhas, like these all things are explained in our Ayurveda. Once dosha, like which dosha is vitiation is there, so what is the condition of that dosha. Next we will move on to roganusara chikitsa, what are the signs and symptoms. First basically I believe on dosha chikitsa, then roganusara and samanya vishesha siddhanta while explaining to the diet related things and to explain the patient what their lifestyle, to see all those things there, that rule will apply. They should not take opposite viruddha ahara, or to increase their muscle bulk, muscle mass, so they have to take increasing the muscle tissues, such type of food articles they have to take. While explaining that, I will follow that, but mainly first concentration is on doshanusara chikitsa.
Ma'am, in Ayurveda, Acharyas explain Dinacharya, Rutucharya, Ratricharya, Sadruta. Different concepts they explain for maintenance of health. How we can inculcate that in maintenance of patient's life in a OPD basis?
Yeah, that's a good question. Actually, it is all explained in our Ayurveda, but many of them, even including we also, we are, because of this lifestyle, stressful life, we are not following Rutucharya and Dinacharya. So, but when patient will comes to us, then we need to explain everything. So it's not we have to wake up at Brahmi Muhurta, because it's not possible nowadays. We have to see their lifestyle also, and I need to explain them. You have to wake up at least 5:30, 6 o'clock and just wash your face and all, gargle with the hot water. Small things we can explain what is told in our classics like Dinacharya, Rutucharya. And season wise, we should eat the season wise fruits and vegetables, not we are export from the other countries. So what is seasonal fruits are available, that food they have to take. And according summer season, we have to take in cold articles. Cold articles is not an ice cream and all what is made. So what is possible in home that's having cold potency, such type of food articles we have to intake. That we will have to take a time and we have to explain the patients. Immediately maybe they are not agree, they will tell we are not getting time, this, that and all. But we have to tell what is the reason behind that, why they have to follow that. Then we have to make them to convince, at least not all together, step by step, one thing they have to follow.
Ma'am, we know that every science has its own base and own siddhanta. What is the factor that distinguishes Ayurveda from modern medicine?
Okay. In Ayurveda science, I told you already, the dosha siddhanta is the doshik siddhanta. So it is explained that we can compare that with all doshas are explained. It's all actions will be, physiological actions will be explained in the name of doshas. Vata, Pitta, Kapha, three doshas are there. Their functions, all things are explained as the physiological functions, what is explained modern. So same theory, doshic theory, we are adopting in our Ayurveda. And almost like our Panchakarma, I am Panchakarma MD. So Panchakarma Siddhanta is also depending upon the Doshik Siddhanta. We are detoxify mainly the root cause of the diseases. So in that sense, we are not blaming other sciences. So in Ayurveda it is told, distinguish between that, and some of the, maybe few of them there is no side effects they are telling. But if you are given in a proper method in Ayurveda also, we have to, according to your Rikti, proper dosage, everything we have to administer in Ayurveda. So that is there is no side effects and the herbal drugs we are using. So in that, so Ayurveda is distinguished with the modern things.
Ma'am, next, which kind of disease you commonly encounter in your OPD, ma'am?
So in my experience, over 17 years experience, I was well versed in treating the disease of degeneration conditions like osteoarthritis, rheumatoid arthritis, cervical spondylitis, backache like lumbar spondylitis, skin disease like psoriasis and eczema, and some digestive disorders like acidity problems, those who are suffering from ulcers, acidity and irritable bowel syndrome, and few cases like psychological conditions like insomnia, and due to stress and all they are getting not sleep, such conditions, and hypertension due to stress. So such cases I am treating.
Ma'am, in Ayurveda, Acharya explained different types of treatments, and you all know.
Yeah.
Charaka Acharya said that Basti is the main Ardha Chikitsa, and Shushruta said that Rakta Moksha is Ardha Chikitsa, and someone saying Basti is Kampurna Chikitsa. Which is considered to be, according to which is the Ardha Chikitsa and why?
Okay, this is little bit okay. Actually, what like in our Ayurveda, like Ashtavibhagas are there. So my point is like I am practicing Panchakarma, being a Panchakarma specialist. So I used to believe on like Bastis are the Chikitsa. But we can go for like after all the treatments in Sushruta Samhitas and all what they told, after treating all the Panchakarmas, still the disease was not cured. If any problem, then we can go for the Siraveda Chikitsa, the Rakta Mokshana Chikitsa. So, first we can, my belief is like Basti as Ardha Chikitsa, most of the disorders will be cured by the Basti Chikitsa because it is mainly we are treating with the Vata vitiated disorders. Vata is exhibited in our body because, so it is all the body will be controlled by the Vata only. So that will be treated by the, if any disease will occur due to Vata, that will be cured by the Basti Chikitsa. Along with some other treatments also we have to follow. So Basti Chikitsa is main line of treatment, is my opinion.
Ma'am, in Panchakarma you have 5 different principles to treat the disease. Which can we commonly practice in our OPD level basis, ma'am?
OP level basis, again it's depending upon the patient's condition. Is a minor condition, if there is not too much severe condition, then we can OP levels for some minor, we can give the oil to just apply in your home, and some of the like hot fermentation, hot water bag you can keep it in home, and other some lepas we can give to apply in a home or OP level. But if the patient is admitted here, like severe conditions, compulsory they have to admit and take the treatment, otherwise adverse effects will occur. If they were in our Panchakarma, they told after procedures and all, or during the procedures, we have to follow some rules and regulations. They should not travel, they should not sleep in the daytime, they should not expose to cold wind and sunny. So such all things will be there. So if we will send them home, they will do many apatyas. So then they will blame the doctor, the result was not occur. So because of that, we have to make the, if severe condition, make the patient to admit and then give the Panchakarma treatment. Definitely will get the 100% results for these diseases. So better to be patient should stay in OP level. Minor things, so in a OP base, in a clinic you can make a small setup. There you can go for some of these steaming procedures like Nadi Sweda and some Lepa Chikitsas. And one day you can make the patient admit morning to evening. Some polyclinic you can make admit them, and some give mild Virechana Dravyas for the detoxification. So small procedures you can practice in OP level also. Otherwise severe condition, better to be admit and give the treatment.
Ma'am, while explaining, Acharya Charaka has explained different modality of treatment like Daiva Vipasha Chikitsa, Sattvajaya Chikitsa and Yukti Vipasha Chikitsa. But he placed Daiva Vipasha as the first line of treatment. How we can practice in this modern era? How we can justify that the treatment is work?
Okay, it's a good question. In modern practice, it is very difficult to convince the patient starting when they will come to consultant. So we cannot go directly to Daiva Vipasha Chikitsa. First we have to see what is the patient condition, what is he is suffering from. We have to go to the history properly, everything. Then afterwards we have to make, first our line of treatment is our Yukti Vipasha Sattvajaya Chikitsa. So that treatment we have to adopt. Still it is not, patient is not cured. Then little bit we have to think as a Daiva Vipasha Chikitsa. Again we have to ask some history of the patient, and then some scientifically some of the Daiva Vipasha Chikitsa also proved. So as a meditation and chanting mantras, it is scientifically proved already. So we can make them to chant some mantras, and then some in home they can make an homa havanas. Chanting mantras, doing homa havanas, that will make the positive energy to the patient as well as the atmosphere. So such type of Daiva Vipasha Chikitsa we can follow. So it's my opinion. So they can practice Homa, Havana, chanting mantra, meditation, yoga. That things they can follow. And one more thing, it's my experience. Few things I come across. ಸೊ ಇನ್ನು ಕುಲದೇವರು ನಾವು ಹೇಳ್ತೀವಲ್ಲ, ಕುಲದೇವರು ಅದನ್ನು ಕೆಲವೊಂದು ನಡ್ಕೊಳ್ದೇ ಇದ್ರೆ ಕುಷ್ಠ ಸೊ ಇನ್ನು ಆಯುರ್ವೇದ ಆಲ್ಸೋ ದೇ ಟೋಲ್ಡ್ ಕುಷ್ಠವನ್ನು ಪೂರ್ವಜನ್ಮ ಕರ್ಮ ಅಂತ ಹೇಳ್ತಾರೆ. ಸೊ ಅದನ್ನು ಕೂಡ ನಾವು ಏನು ಮಾಡಬೇಕು, ಅವಾಗ ಕೆಲಸ ನಮ್ಮದು ಇದರಿಂದ ಟ್ರೀಟ್ಮೆಂಟ್ ಕಮ್ಮಿ ಆಗದೇ ಇದ್ದರೆ, ಸೊ ಅದನ್ನೇನಾದರೂ ಇದ್ದರೆ ನಾವು ಅದನ್ನು ನೀವು ಮಾಡಿ ಅಂತ ನಾವು ಒಂದು ಸಜೆಷನ್ ಪೇಷಂಟ್ಸಿಗೆ ಕೊಡ್ಬೋದು. ಅದನ್ನು ಅವ್ರು ಬಿಲೀವ್ ಮಾಡುವಂಥ ಇದ್ದರೆ ಅದನ್ನು ಅವರಿಗೆ ಕನ್ವಿನ್ಸ್ ಮಾಡಿ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿ ಅದನ್ನು ಕೂಡ ನೀವು ಫಾಲೋ ಮಾಡಿದರೆ ನಿಮ್ಗೆ ಒಳ್ಳೇದಾಗತ್ತೆ ಅನ್ನೋ ಒಂದು ದೃಷ್ಟಿಲಿ ನಾವೆಲ್ಲವನ್ನು ಹೇಳ್ಬೋದು ಅವರಿಗೆ.
ಕನ್ನಡದಲ್ಲಿ ಒಂದು ಮಾತಿದೆ, ಮನಸ್ಸಿದ್ದೆ ಮಾದೇವ, ಮನಸ್ಸಿನಂತೆ ಮಾದೇವ ಅಂತ.
ಮನಸ್ಸಿದ್ದರೆ ಮಾರ್ಗ ಅಂತ ಕೂಡ ಹೇಳ್ತಾರೆ.
ಚರಕ ಹೇಳಿದಾರೆ ಸತ್ವಾಜಯ ಇಸ್ ಒನ್ ಆಫ್ ದ ಮೈನ್ ಆಫ್ ಟ್ರೀಟ್ಮೆಂಟ್. ವಾಟ್ಸ್ ಯುವರ್ ಒಪಿನಿಯನ್ ಆನ್ ಸತ್ವಾಜಯ ಚಿಕಿತ್ಸಾ?
ಸತ್ವಾವಜಯ ಚಿಕಿತ್ಸೆ ನಮ್ದು ಯಾವುದೇ ಒಂದು ರೋಗ ಬರಬೇಕಾದ್ರೆ ಬರೀ ನಮ್ಮ ದೇಹದ ಸಂಬಂಧಿತ ಕಾರಣಗಳಲ್ಲ, ನಮ್ಮ ಮಾನಸಿಕ ಒತ್ತಡಗಳು ಮತ್ತು ಮಾನಸಿಕ ಕಾರಣಗಳು ಕೂಡ ಇರುತ್ತವೆ. ಈಗ ನಮ್ದು ಈಗ ಎಕ್ಸಾಂಪಲ್ ಜಸ್ಟ್ ಒನ್ ಐ ವಿಲ್ ಗಿವ್ ಡ್ಯೂರಿಂಗ್ ಎಕ್ಸಾಮ್ we are having tension, we are not eating food, so because of that tension so ಏನಾಗುತ್ತೆ ನಾವು ಊಟ ಮಾಡಲ್ಲ, ಸೊ acidity problem will occur. Because of exam we are not sleeping throughout the night, ಆವಾಗದು ನಮ್ಮದು ಪ್ರಾಪರ್ ನಿದ್ದೆ ಆಗಿಲ್ಲ, ಊಟ ಸರಿಯಾಗಿಲ್ಲ. ಸೊ ದಟ್ಸ್ ಒನ್ ಮಾನಸಿಕ ಕಾರಣ, ಡ್ಯೂ ಟು ಟೆನ್ಷನ್, ಸ್ಟ್ರೆಸ್ ಆಗಿರುತ್ತೆ. ನಮ್ಮದು ಸತ್ವ ಏನಾಗುತ್ತೆ ಅವರ ಸತ್ವ ಆಗಿ ಆವಾಗ ಏನಾಗುತ್ತೆ ಆ ಕಾರಣದಿಂದ ನಮ್ಮದು acidity ಪ್ರಾಬ್ಲಮ್ಮು, ಬೇರೆ ಮತ್ತು ಸುಸ್ತಾಗೋದು, ಆ ಥರದ ಡಿಸೀಸ್ಗಳು ಶುರು ಆಗುತ್ತೆ. ಸೊ ಒಂದಕ್ಕೊಂದು ಏನಿದೆ ಬರೀ ಇದೊಂದೇ ಅಂತ ನಮ್ಮದು ದೇಹದ ಕಾರಣಗಳು ಅಂತ ಅನ್ನೋದಕ್ಕಿಂತ ಮಾನಸಿಕ ಕಾರಣಗಳು ಕೂಡ ಇದಕ್ಕೊಂದು ನಮ್ಮದು ಡಿಸೀಸ್ ಓಪನ್ ಆಗೋದಕ್ಕೆ ಅದೊಂದು ಕಾರಣ ಇರುತ್ತೆ. ಸೊ ಎರಡನ್ನೂ ನಾವು ಟ್ರೀಟ್ ಮಾಡೋದ್ರಿಂದ ಒಂದು ಸತ್ವಾವದ ಚಿಕಿತ್ಸೆ ಆಲ್ಸೋ ಸೇಮ್ ಇಂಪಾರ್ಟೆನ್ಸ್ ಟು ಬಿ ಗಿವನ್ ಆ್ಯಸ್ ಅ ಯುಕ್ತಿ ವ್ಯಪಾಶ್ರಯ ಚಿಕಿತ್ಸಾ, ಅದನ್ನು ನಾವು ಕೊಡಬೇಕಾಗುತ್ತೆ.
ಮ್ಯಾಮ್, ಹೌ ಯು ಕ್ಯಾನ್ ಅಪ್ರೋಚ್ ದ ಪೇಷಂಟ್ ಟು ಕನ್ವೆ ಅವರ್ ಲೈನ್ ಆಫ್ ಟ್ರೀಟ್ಮೆಂಟ್?
ಇದು ತುಂಬ ಕಷ್ಟಕರವಾದ್ದು. ಆ್ಯಕ್ಚುಲಿ ಈಗಿನ ಜನ್ರೇಷನ್ ಹೇಗಿದೆ ಅಂದರೆ ನಮಗೊಂದು ಟ್ಯಾಬ್ಲೆಟ್ ತೊಗೊಂಡು ಬೇಗ ಕ್ವಿಕ್ಕಾಗಿ ರಿಲೀಫ್ ಆಗಿಬಿಡಬೇಕು ಅಂತ ಹೇಳ್ತಾರೆ. ಅದನ್ನು ನಾವು ಅವರಿಗೆ ಮನವರಿಕೆ ಆಗೋವರೆಗೂ ವಿ ಹ್ಯಾವ್ ಟು ಸ್ಪೆಂಡ್ ಸಮ್ ಟೈಮ್ ಟು ದ ಪೇಷಂಟ್. ಅವ್ರ ಜೊತೆಗೆಲ್ಲ ಚೆನ್ನಾಗಿ ಮಾತಾಡಬೇಕು, ಅವ್ರ ಹಿಸ್ಟ್ರಿ ಕೇಳಬೇಕು, ಅವನ್ನೆಲ್ಲ ಮಾಡಿ ಈ ಥರದ ನಮ್ಮದು ಟ್ರೀಟ್ಮೆಂಟ್ ಮೊಡಾಲಿಟಿ ಅದ್ರದ್ದು ಆ್ಯಕ್ಷನ್ನು ಏನು ಅಂತ ಅವ್ರಿಗೆ ಚೆನ್ನಾಗಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿ, ಅದರಲ್ಲೂ ಪಂಚಕರ್ಮ ಚಿಕಿತ್ಸೆ ಅದು ಇಟ್ ವಿಲ್ ಟೇಕ್ ಸೋ ಮಚ್ ಟೈಮ್ ಟು ಎಕ್ಸ್ಪ್ಲೈನ್ ದ ಪೇಷಂಟ್, ಟು ಕನ್ವಿನ್ಸ್ ದ ಪೇಷಂಟ್ ಟು ಟೇಕ್ ದೀಸ್ ಆಫ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಲೈಕ್ ವಮನ, ವಿರೇಚನ, ಬಸ್ತಿ. ಇಮಿಡಿಯೇಟ್ಲಿ ಪೇಷಂಟ್ಸು ಯಾರೂ ಒಪ್ಕೊಳ್ಳೋದಿಲ್ಲ. ಸೊ ಅದರದ್ದು ಅವ್ರಿಗೆ ಅರ್ಥ ಮಾಡಿಸ್ಕೊಡ್ಬೇಕು, ಇದರಿಂದ ನಿಮ್ಗೆ ಏನು ಬೆನಿಫಿಟ್ ಇದೆ, ಇದು ನಿಮ್ಗೆ ಎಷ್ಟು ಒಳ್ಳೇದಾಗುತ್ತೆ ಅನ್ನೋದನ್ನ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿ, ಅದರದ್ದು ಏನೇನು ಪ್ರೊಸೀಜರ್ ಹೇಗಿರುತ್ತೆ ಅನ್ನೋದು ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿ ಅವ್ರಿಗೆ ಮಾಡಿಸಿದ್ರೆ ದೇ ವಿಲ್ ಕನ್ವಿನ್ಸ್ ವಿ ವಿಲ್ ಸಿನ್ಸ್ 17 years I am doing the same. Now also I am doing the same thing because in every area every patient is different. But one patient get cured, definitely they will bring so many more patients. They will explain the things. At the time no need to explain many things. They will be, and again nowadays patients after COVID many patients are having the awareness regarding the Ayurveda. So they were started believing on Ayurveda. So they were coming with us, we need a detoxify treatment. So they need, and many metropolitan cities they are not getting time. So whenever they are having vacation they are coming and they are taking the detoxification treatments also. So little bit is starting we need to explain. Then afterwards it will be beneficial for them. Then automatically they will bring patients and they will all come to our treatment.
Ma'am, usually people think that Ayurveda andre patyapatya. They will prescribe patyapatya. So we want to go. What's the key role of Anupana in giving medicine? Anupana with the medicine, ma'am. Anupana
with medicine. Actually, main thing patyapatya is there, but nowadays patients are not so much following the patyapatya, but little bit in what they are taking food. In that only we have to make some alterations. We have to make some alterations and make them convenient. It's taste should be good. So such diet should be explained to the patient. And Anupana usually just an example, one avipattika chod, one medicine is there. We can give with a milk also and we can give with a warm. Many of the patients they are not able to take milk, then we can give with a warm water. That and different medicines we are giving with a different Anupana, that will increase the potency of that drug. So and again we will get a more good benefits because of the Anupana. And one more thing, Aushadha Sevana Kala you told. So Aushadha Sevana Kala in different I told you dosha Siddhanta and which dosha is aggravated, and when the patient is more feeling pain or something, in which condition, asking all those conditions we can give in the, for example, Shodhana purpose we are giving early morning in empty stomach Sneha Dravyas. And if you want to give for the Shamana purpose, before food we have to give the medicine. And again we want to make a Brahmana line of treatment. For nourishment purpose if you want to give, so then you have to give the after food. So like that Aushadha Sevana Kala, it will having the more important role, key role in our Ayurveda practice. So according to that, we can practice.
Ma'am, what is your view on integrating both Ayurveda with modern medicine?
Yeah, nowadays, my opinion is integrated medicine is very good, and because we should know the nowadays in the present era, we should know all the knowledge about the sciences, Ayurveda, modern science. Integrated is also like it's a good, what is our some chronic disorders and other disorders, skin disorders, we are treating with our treatment. Any little bit emergency management we need a modern help. So if we go for the integrated science, if they will also believe like together we can practice, then definitely we can go a good result to the patients. Their aim and our aim is, main aim is the patients should be cured and they should live the healthy life. So thinking of that, integrated science we can practice, no issues.
Now, what is the biggest problem in practicing Ayurveda in this era?
Already little bit in while explaining other things also I told. All in Ayurveda what happened, many patients they will go around all the sciences. They will first go to modern science, then again homeopathy, some other these things and all. Then at the end they will come to Ayurveda consultant. And at the time they will come, they want immediate result within a week, within 2 days they want result. That is the main point, big challenge for Ayurveda physician we are facing. So we need to convince the patient, and we need, these are the critical, which is Sadhya Vyadhi or Asadhya Vyadhi, Yapya Vyadhi. We have to explain them everything. We have to convince the patient, then we have to give them treatment. If they are not having any belief in Ayurveda, then it is very difficult to treat them. So these are the few of the challenges we are facing as a being Ayurveda physicians. And main thing, like they are comparing. They are asking, even though they won't ask any questions to modern consultants, they will not answer for that also. Whatever they are having doubts, they will come and ask to Ayurveda physician. They want to clear all those doubts. One main thing, like we should have that knowledge, then we have to explain the patients, and then we have to convince the patients. That is the main big challenge we have to convince. And one more thing, what is the thing is, they will spend so much money in modern practice, modern treatment, but once they will come to us, they are not ready to pay financial. They will tell, they will like in market bargaining, they will start doing that one. That we have to convince the patient. They are not ready to accept, oh, this much expense is there for these treatments. Medicines also like herbal drugs, it is not so easily available. We have to collect in different from different areas. We are collecting, we have to purify them, then we are converting into medicine. So much struggle is there behind that, and that work they are not understanding. So that we have to convince the patient. My intention to convey through this, I want to convey all the general public, they have to think in the same manner. So how much is equal to modern, that much equal importance they have to give to Ayurveda also.
Ma'am, you are guided with many research papers for PG thesis. What is the challenge that you are facing in research, ma'am, in Ayurveda?
Research in Ayurveda. Yeah, my 3 students are PG scholars, are accepted, like they are in research fund. There is a PG star from CCRS projects. So they are giving fund, that they are doing. But while doing, like again convincing the patients, and again we are to do more things, more research, wide research and different instrumentations. So there we need again more fund. So that's the one main thing we are facing, because fund is what they are giving is, it is not sufficient. For small projects it is sufficient. For big projects, big surveys we want to do, and again some advanced techniques we want to use in the Ayurveda to prove that. So there we need a more financial support from the government or some other sources that we are facing. Otherwise it will be fine. And some more, like if free treatments are there, many patients are coming, so we can go for trial methods in patients, then we will get good results from that. That also, like to get more and more patients is a little bit difficult.
Ma'am, in prior I mentioned that every science has its own base and own principles. Yeah. What is the challenge in proving the Ayurvedic concept in terms of modern terms, ma'am? Usually research in terms of modern things we need to prove the Ayurvedic concept.
Yeah.
How difficult to prove that?
Yeah, it's very difficult actually. Our science, our Siddhanta is many told, like Dosha Siddhanta is there, Dhatu Siddhanta, Samanya Vishesha Siddhanta. sometimes it's like we are one step back to prove that. They all like want that modern perspective. We have to go for lab investigations, and again some MRI, such things are with lab investigation before and after treatment. They want in that sense too, we have to prove scientifically, we want to prove it off. So that is somewhere like we have, it's very difficult to prove that, but still we want to stand along with the modern science. Definitely we want to, along with the modern equipments, modern lab investigations, we have to adopt along with our Ayurveda principles, like Roga Rogi Pariksha, Dashavida Pariksha that told, Ekadasha Pariksha, Ashtavida Pariksha, that all, and Prakriti, Samvahana. So many things they told in our Ayurveda. We want to take those things along with modern parameters, then we want to prove in front of them as a researcher. So both Ayurveda Siddhanta, basic thing we have to keep, that's our Ayurveda Siddhanta, and then along with the modern parameters we have to make it, we have to prove it and publish as a research article. Then only it is acceptable in global level.
Ma'am, what's your view on proving the disease in Ayurveda using the modern diagnostic techniques like ECG or whatever the diagnostic techniques you are using? How we can prove that Ayurveda diagnose in Ayurvedic manner, ma'am?
That's what I told you, like Dashavida Pariksha, Ashtavida Pariksha, that all things we told. There's a clinical examination. In olden days there is no modern equipments were there. So with that examination, only clinical examination, with that Darshana, Sparshana, Prashna, Pariksha they told in our Ayurveda. With that we have to do the examination only to confirm that it's because we are treating the lives actually. Those who are live, the life is there. So we main intention is our intention, even maybe Ayurveda Vaidya, modern Vaidya, the patient get be cured. So thinking of our Ayurveda Siddhanta, keep that, go for all the examinations. Then to confirm it, again nowadays many modern equipments are came. So because of that, like, we have to go with that modern equipments, go for some examinations, then confirm it, and then our Ayurveda treatment we can go for that. In example in diabetes they told urine examination, Mutra Pariksha explained in Ayurveda. We have to do with Mutra Pariksha. Then again we can go for the examination like RBS, GRBS, fasting, blood sugar, that blood sugar test also you can do. And what you feel correct according to the patient condition, our Ayurveda Siddhanta is a Medha Dhatu increased or Kapha involvement is there. According to that you can explain the diet, and our Ayurveda treatment according to our Siddhanta you can treat them. And main thing there in we are not blaming. Our Ayurveda, we are mainly the root level, what is the root cause of the treatment we are thinking. In that level we will go depth and we are treating. Maybe immediately within 2 days we will not get the result, within week we will not get result. One fine day it is completely cured. As a Panchakarma specialist, in all treatments, the first basic line of treatment is detoxification. We have to purify the body first. After purifying whatever we are giving medicine, that will be more beneficial. It's a fruitful result we will get. So it's a given example like the one white cloth, what we dye is looking very nice. In dirty cloth, if you put the dye, then again it will looks dirty only. Same thing if you go for first purified treatment, it may be mild, moderate, or like drastic virechana or vamana, whatever the things are there, that you can first do it. Then whatever the treatments you are giving, that will be more result we will get from the patient.
Ma'am, what's your view on to see Ayurveda as a mainstream of medicine in this current world or in future?
Future. Once again, pardon the question.
ಆಯುರ್ವೇದವನ್ನು ಮೇನ್ ಸ್ಟ್ರೀಮ್ ಆಫ್ ಮೆಡಿಸಿನ್ ಆಗಿ ನೋಡೋದ್ರಲ್ಲಿ ನಿಮ್ಮ ವಿಷನ್ ಏನಿದೆ ಅಥವಾ ಏನು ಸಂದೇಶವನ್ನು ಕೊಡ್ತೀರಾ ನೀವು ಜೂನಿಯರ್ಸ್ ಡಾಕ್ಟರ್ಸ್ಗಳಿಗೆ?
ನಂದು ಒಂದು ಉದ್ದೇಶ ಅಂದರೆ ಈಗಿನ ಲೈಫ್ ಸ್ಟೈಲಿ ಮಕ್ಕಳು ಜಾಸ್ತಿ ಡೆಪ್ತಾಗಿ ಓದೋದೇ ಇಲ್ಲ. ಸ್ವಲ್ಪ ಸ್ವಲ್ಪ ಓದಿ ಇದನ್ನೇ ಒಂದಿಷ್ಟು ಮೆಡಿಸಿನ್ ಕೊಟ್ಬಿಟ್ರೆ ಆಯಿತು ಅಂತ. ಬಟ್ ನಂದು ಒಂದು ಮಕ್ಕಳಿಗೆ ಸಂದೇಶ ಏನಂದರೆ, ದೇ ಹ್ಯಾವ್ಸ್ ಟು ಸಿನ್ಸಿಯರ್ಲಿ, ದೇ ಹ್ಯಾವ್ಸ್ ಟು ಸ್ಟಡಿ ವಾಟ್ ಇಸ್ ದ ಡೆಪ್ತ್ ಆಫ್ ದಟ್, ವಾಟ್ ಅವರ್ ಸಂಹಿತಾಸ್, ಕ್ಲಾಸಿಕ್ಸ್, ಆಯುರ್ವೇದ ವೈದ್ಯಾಸ್ ಟೋಲ್ಡ್. ದೇ ಹ್ಯಾವ್ಸ್ ಟು ಸ್ಟಡಿ ರೆಗ್ಯುಲರ್ಲಿ, ಸಿನ್ಸಿಯರ್ಲಿ, ಬಿಕಾಸ್ ಎವ್ರಿ ಟೈಮ್ ನಾವು ಓದುವಾಗ ನಮಗೊಂದು ಹೊಸದಾಗೇ ವಿಷಯ ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ಆ ಥರ ಚೆನ್ನಾಗಿ ಓದಿ ಅರ್ಥ ಮಾಡಿಕೊಂಡು ಅದರದ್ದು ಬೇಸಿಕ್ ರೂಟ್ ಕಾಸ್ ಏನಿದೆ ಅದನ್ನು ಕಂಡು ಹಿಡ್ಕೊಂಡು ಅವರು ಟ್ರೀಟ್ಮೆಂಟನ್ನು ಕೊಡ್ತಾ ಹೋದರೆ ಅದು ಇನ್ನೂ ಅಂದರೆ ಇಲ್ಲಿಗೆ ನಮ್ದು ಈಗ ಇಂಡಿಯಾಕ್ಕಷ್ಟೇ ಸೀಮಿತ ಅಲ್ಲ, ಗ್ಲೋಬಲ್ ಲೆವೆಲ್ಗೂ ಮಕ್ಕಳು ಬೆಳೆಸ್ಕೊಂಡು ಹೋಗ್ಬೋದು. ಇದು ಬರೀ ನಾವು ಆಯುರ್ವೇದ ಪ್ರಾಕ್ಟೀಷನರ್ ಆಗಿ ಮಾತ್ರ ಕೆಲಸ ಮಾಡೋದಂತ ಇದರ ಸ್ಕೋಪ್ ಇರಲ್ಲ. ಆಯುರ್ವೇದದಲ್ಲಿ ನಾವು ಒಳ್ಳೆಯ ಡ್ರಗ್ ಮ್ಯಾನುಫ್ಯಾಕ್ಚರ್ ಆಗ್ಬೋದು. ಇದು ನಮ್ಮದ್ರಲ್ಲಿ ರಸಶಾಸ್ತ್ರ, ಭೈಷಜ್ಯ ಕಲ್ಪನಾ, ದ್ರವ್ಯಗುಣ ಅಂತೆಲ್ಲ ಸಬ್ಜೆಕ್ಟ್ಸ್ ಇದೆ. ಅದನ್ನು ಚೆನ್ನಾಗಿ ಡೆಪ್ತಲ್ಲಿ ಕಲ್ತ್ಕೊಂಡು ಅದನ್ನು ಅವ್ರ ಓನಾಗಿ ಮ್ಯಾನುಫ್ಯಾಕ್ಚರ್ ಯೂನಿಟ್ ಮಾಡಿ ಅದನ್ನು ಹೊರಗಡೆ ದೇಶಕ್ಕೂ ಕೂಡ ನಾವು ಅದನ್ನು ಎಕ್ಸ್ಪೋರ್ಟ್ ಮಾಡೋ ಥರ ನಾವು ಸ್ಕೋಪ್ ಮಾಡ್ಬೋದು. ಆಮೇಲೆ ರಿಸರ್ಚ್ ಲೆವೆಲಲ್ಲಿ ಡಿಫ್ರೆಂಟ್ ರಿಸರ್ಚ್ ದೊಡ್ಡ ದೊಡ್ಡ ಕಂಪ್ನೀಸ್ ರಿಸರ್ಚ್ ಲೆವೆಲ್ಸ್ ಇರುತ್ತೆ. ನಮ್ಮ ಆಯುರ್ವೇದ ಮೆಡಿಸಿನ್ಸನ್ನ ಈಗ ಬೇರೆ ದೇಶದವ್ರು ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಅದನ್ನು ನಾವು ಯಾಕೆ ಅದನ್ನು ಮಾಡಬಾರ್ದು? ನೀವು ಜೂನಿಯರ್ ಡಾಕ್ಟರ್ಸ್ ಆಗಿ ನಿಮ್ದು ಇನ್ನೂ ಮಾಡರ್ನ್ ಟೆಕ್ನಾಲಜಿನ ಯೂಸ್ ಮಾಡಿ ನೀವು ಒಳ್ಳೆ ಮೆಡಿಸಿನ್ಸ್ ರೆಡಿ ಮಾಡಿದ್ರನ್ನ ಅದು ಒಳ್ಳೆದನ್ನು ಟ್ರೀಟ್ ಮಾಡಿ. ಮೇನ್ ಥಿಂಗ್ ಇಸ್ ಡಾಕ್ಯುಮೆಂಟೇಷನ್ ಇಸ್ ವೆರಿ ಮಚ್ ಇಂಪಾರ್ಟೆಂಟ್. ಫ್ರಮ್ ದ ಫಸ್ಟ್ ಡೇ ವೆನ್ ಯು ಸಿಟಿಂಗ್ ಫಾರ್ ಪ್ರಾಕ್ಟೀಸ್ ಆರ್ ಟೀಚಿಂಗ್, ವಾಟ್ ಎವರ್ ಇಸ್ ದ ಡಾಕ್ಯುಮೆಂಟೇಷನ್ ಇಸ್ ವೆರಿ ಮಚ್ ಇಂಪಾರ್ಟೆಂಟ್. ಬೈ ದಟ್ ಡಾಕ್ಯುಮೆಂಟೇಷನ್ ಯು ಕ್ಯಾನ್ ಪ್ರೂವ್ ದ ವರ್ಲ್ಡ್ ವೈಡ್ ವಾಟ್ ಈಸ್ ಯು ಆರ್ ಡೂಯಿಂಗ್. ಸೊ ನಿಮ್ಗೆ ಅದು ಪ್ರೂವ್ ಮಾಡಲಿಕ್ಕೆ ಡಾಕ್ಯುಮೆಂಟೇಷನ್ ಬಿಫೋರ್ ಟ್ರೀಟ್ಮೆಂಟ್, ಆಫ್ಟರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಅದನ್ನೆಲ್ಲ ನೀವು ಪ್ರೂವ್ ಮಾಡಿ ತೋರಿಸ್ಬೋದು. ಗ್ಲೋಬಲ್ ಲೆವೆಲಲ್ಲೂ ಕೂಡ ಅಂದರೆ ನಂದು ಇದು ಅಂತಂದರೆ ಬರೀ ಇಷ್ಟಕ್ಕೆ ಸೀಮಿತವಾಗಿ ಇಟ್ಕೊಳ್ಳೋದು ಬೇಡ. ಹೊರಗಡೆ ದೇಶಕ್ಕಾಗಲಿ ನಮ್ಮದು ವರ್ಲ್ಡ್ ವೈಡ್ ಫುಲ್ ಎಲ್ಲದಕ್ಕೂ ನಮ್ಮದು ಆಯುರ್ವೇದ ಏನನ್ನು ತೋರಿಸ್ಕೊಡೋದು ನಮ್ಮದು ಜೂನಿಯರ್ಸ್ ಡಾಕ್ಟರ್. ಯಾಕಂದರೆ ನಮ್ಮಕ್ಕಿಂತ ನೀವು ಇನ್ನೂ ಜಾಸ್ತಿ ಈಗಿನ ಟೆಕ್ನಾಲಜಿನ ಅರ್ಥ ಮಾಡ್ಕೊಂಡಿದ್ದೀರಾ. ಅದ್ರ ಪ್ರಕಾರ ನೀವು ಆ ಟೆಕ್ನಾಲಜಿನ ಯೂಸ್ ಮಾಡಿಕೊಂಡು ನಮ್ಮ ಆಯುರ್ವೇದ ಸಿದ್ಧಾಂತನ ಅದೇ ಇಟ್ಕೋಬೇಕು. ಅದನ್ನ ಇಟ್ಕೊಂಡು ಮಾಡರ್ನ್ ಟೆಕ್ನಾಲಜಿನ ಅಡಾಪ್ಟ್ ಮಾಡಿಕೊಂಡು ಅದನ್ನು ಪ್ರೂವ್ ಮಾಡೋದ್ರಲ್ಲಿ ನೀವು ಯಶಸ್ವಿಯನ್ನು ಗಳಿಸಿ ಅಂತ ನನ್ನೊಂದು ಸಂದೇಶ ಮಕ್ಕಳಿಗೆ.
ಮ್ಯಾಮ್, ಈಗ ಇನ್ ದ ಮಾಡರ್ನ್ era ಆಯುರ್ವೇದಿಕ್ ಕಾಸ್ಮೆಟಿಕ್ಸ್ ಆರ್ ನಾಟ್ ಹಾರ್ಮ್ಫುಲ್, ದೇ ಆರ್ ಗುಡ್, and Ayurvedic dermatology is good for the skin. What's your view on that?
So main thing in our Ayurveda classes already told long years back, is 5,000 years back also it is told in our Ayurveda classics. Again we have to practice that one. Many skin dermatology, many skin disorders like example psoriasis and eczema and fungal infection, that all things are there. So it is not immediately cured by some applying ointment and taking many steroids. No problem, you can take that also, but again it will reoccur. So once like I was being a panchakarma and in our practice what I observed in my 17 years of experience, once we go for like vamana, virechana, such line of treatments, purify, then it will be not reoccur. Along with that it is not told that only it's not reoccur means it is not come back. But if the patient lifestyle, he has to change his lifestyle, diet he has to follow, because in a so much like fast life they are not giving time to themselves. Only they are earning money. They are morning to night they are working that. So they are junk foods they are eating so much. So it is not only one day if you eat junk food you will get a skin diseases. So it's a continuous process, long duration they were taking. Then definitely one they will suffer from some dermatological conditions or many other disorders. ಸೊ ಅದು ನಮ್ಮದು ಪಂಚಕರ್ಮ ಟ್ರೀಟ್ಮೆಂಟ್ ಜೊತೆಗೆ ಅದನ್ನು ದ್ಯಾಟ್ ಟು ಸ್ಪೆಸಿಫಿಕಲಿ ದೋಸ್ ವಾಸ್ ಪಂಚಕರ್ಮ ಸ್ಪೆಷಲಿಸ್ಟ್. ಇಟ್ಸ್ ನಾಟ್ ಸಂಬಡಿ ಮೆನಿ ರೂಮರ್ಸ್ ಲೈಕ್ ಮೆನಿ ಆಫ್ ದೆಮ್ ಆರ್ ಪ್ರಾಕ್ಟಿಸಿಂಗ್ ಸ್ಪಾ ಲೈಕ್ ಮಸಾಜ್ ಇಸ್ ಅ ಪಂಚಕರ್ಮ ಟ್ರೀಟ್ಮೆಂಟ್. ಸೊ ಐ ವಿಲ್ ಟೆಲ್ ಆಲ್ ದ ಪೀಪಲ್, please consult the specialist of panchakarma, unique specialist, those who are panchakarma specialists, you consult them and go for the panchakarma line of treatment, then go for some medications. Definitely we are having good results in dermatology and cosmetology. So few treatments are told in Ayurveda also, and nowadays like advanced techniques are coming. So along with our Ayurveda treatment we can adopt the cosmetology like laser treatments and all. So it's a integrated science what we are telling, that is a good benefit. But along with that treatment, our Ayurveda treatments, it is a dinacharya I told, daily we have to do abhyanga. So once we'll go for like a daily abhyanga with oil, otherwise at least once, because nowadays they are telling no time, at least once in 2 days or once in a week they can go for like mild massage with the face, apply the oil, some lepa chikitsa, then nadisa sweda chikitsas if they will go for that, and some nasse they told as a daily basis, some 2 drops they are putting the nasse treatment. Definitely day by day the skin will glow, definitely the skin will glow, and there is no need of applying of many creams, that is all made up of chemicals only. After applying that treatment, the skin will one day find that one even for 30 cross the skin will become looking aged skin. That should be avoided. That basic line of treatment, the dinacharya, that we have to follow, that we have to explain the patient. Some of the like moles are there nowadays, it is a more common in everybody's moles and all. To remove that, that in our Ayurveda practitioners, those who are surgeries, they are practicing that also. And some of the advanced techniques we can use, cosmetology treatment we can take, and after that we can go for our Ayurveda treatments also, like the application of lepa, then some Shastika Shalipindas for the glow, for the suntan removal. Our treatments also we can apply. Both science, I cannot blame them because advanced technology they were using. So if you want, you can learn that also, and with Ayurveda Siddhanta you can practice both the things. That is again more beneficial for you.
Ma'am, you said that suntan, it is now current problem. People used to try all the sunscreens. Then there is a trend using Nalpamradi Taila is remove the tan. They will come without knowing their Prakruti, they will apply Nalpamradi Taila. Then they suffer from some issues. Then they blame Ayurveda Tailas are not good. Because Nalpamradi contain Aridra, skin will become yellow color. What is that? What is your view in taking the medicine simply from the medicine, medical and applying?
That's what just now I told. Whenever you want to, without simply going and collecting medicine from, taking medicine from pharmacy, definitely it will give some of the side effects, because they are not assessing their prakriti, skin assessment, which type of skin they are having, what they has to do. Better, my opinion is better they has to go to consultants. Even they want to go for surgery, we are consulting surgeon only. So in the same, our Ayurveda having surgeons are there, skin specialists are there, Panchakarma specialists are there, general physicians are there, even gynecologists. Even in Ayurveda we are having so many branches. They has to consult this particular department doctors, then they has to go for a treatment. Otherwise simply they will blame. That's my opinion. Don't do that one. It's my convey to all the general public and everybody. Please, whatever you have problem, just go and consult the related the related department doctors, and then take the treatment. Otherwise simply going, somebody told maybe that Nalpamradi Taila example, that will help for your friend, but it is not suitable for your skin. Even Haridra, like it is there, one content is Haridra is a Arshina Pude ide. Adu ellaರಿಗೂ skin suit ಆಗಲ್ಲ, ಕೆಲವು skin ಮತ್ತೆ ಕಪ್ಪಾಗುತ್ತೆ, ಮತ್ತೆ ಕೆಲವರಿಗೆ ಅದು ಗ್ಲೋ ಕೊಡುತ್ತೆ. Many examples are coming. We have to Upton ಅಂತ ಹಚ್ಕೋಬೇಕು, Haridra content, Vico turmeric ಅಂತ ಬರುತ್ತೆ. ಇವೆಲ್ಲ advertisement because they want marketing. But we have to think what is suitable for our skin. Then better to be consult related consultants, then purchase the medicine, and that to be when we have to apply, when we have to take wash, that all things will be take the physician help. Then only you can try on your skin.
Ma'am, what's your view on updating Ayurvedic science? They were saying it's not at all updating. From past they were studying the same things. That is not applicable for this today present era.
No, it is not like that, because they are not studying, I think. They are not, what is a published article, they are not reading. It is updating, because when I am studying my Ayurveda, nowhere having the belief on Ayurveda. It's very difficult for me to give medicines to 1 or 2 patients also. It's very difficult, they are not believing in Ayurveda. But nowadays, if I go to my native place itself, 7 to 8 Ayurveda clinics are there. Many doctors are practicing Ayurveda. So patient is having that awareness. Many updates are also there. Recently our students, PG scholars, they were attended on conference. They presented as a like assessment of the Prakriti, and again Sarataha Samhana, it is explained in our Ayurveda. Through AI mode. Through AI they presented as a presentation, and they got a prize also. So they were opting for the like research, like they told that you come and we will do the both research on that, and we will publish an article and we will send the message to the public. So same thing, it is advanced, is growing, Ayurveda is growing. And again worldwide, before it was a yoga is not National Ayurveda Day, National Yoga Day, it was not there. But nowadays it has become worldwide. We are celebrating as a National Ayurveda Day, and again a National Yoga Day. We are seeing in nowadays in social media, many of them are practicing yoga. Many social medias, small reels are coming. We have to take this medicine to improve our health. So that itself is an advancement of the Ayurveda. But still they are making some small things. But in that also we have to see which is correct, which is not correct. Many quacks are also like they are doing. So better to be go proper thorough knowledge, consult a doctor, then go for the treatment. So its advance is going on. It is there. Since when I am learning is like almost 17 years, 20 years. So it is growing. It is reach up to that level. But still my intention is still it should reach up to the sky level. So we all should work hard behind
recently that. PCOS changed to PCOM. Before they are saying Ayurveda physician just they treat any disease, they will treat with Deepana Pachana drugs. Now they are saying it is a multi-metabolic and polycystic ovarian syndrome. Not only the disease related to the ovaries. What's your view on that? Before Acharya said that Agni is the main cause of every disease.
Yes, you are right. in our Ayurveda classics, for everything, main cause is Agni. There is a Mandagni is there. So all of you know, whatever we are eating, our eating, that will go to digestive system, and from there the nutrition will go to all over the body. So just you think the metabolism, it is through Agni only. So what is the Mandagni? First, whatever is there, if it's Agni Mandya is there, like very less appetite is there. So if you are giving so many medicines to them, what will happen? He is not able to digest itself, right? So first you have to make correct the Agni. Then again, whatever is the treatment we want to give, like you told PCOS, PCOD, that all nowadays is very much popular. Like many of the young girls, they are suffering from these all things. So we have good line of treatment in Ayurveda, and we have to treat with the first with the Agni line of treatment, because of that, again Panchakarma line of treatment, like example we are treating with the Vamana and Virechana. So that with that purificated treatments, our metabolism will become correct, endocrine system will become correct. Because of that, because our purification not only to clean the stomach, it is from head to toe, all the channels will become purified. So the metabolism will become correct, the endocrine system will become correct, the irregular menstruation, whatever the bleeding problems, whatever the PCOS symptoms are there, that will also become correct with this treatment. But they have to visit the proper specialist, Panchakarma specialist, or Ayurveda gynecologist, our Sri Prasuti, what we are telling. So we have to consult that doctor, and it's in our science also. Maybe I am Panchakarma specialist, and we need each other help. Like Shalya, they will, for some treatments, they need first purification, even skin diseases, gynecological disorders. They need the support of Panchakarma specialist. First we have to do the Panchakarma treatment, then we have to refer back, and then that department has to give some oral medications. Definitely we are having good results in PCOD, PCOS.
Ma'am, at last, what's your key words for budding doctors and future doctors?
Already just I told. Only my opinion is, all of you, whatever is studying, maybe it is Ayurveda or any other science, go in depth. Not only superficial 1-2 like shlokas or one line of treatment, what your doctors are treating. Only don't fix yourself in that. Go in depth, treat new diseases, go to the root cause, and then sincerely you work, and whatever you are having doubts, you clear with your teachers, Vaidyas, and go for like full time. You have to involve in that your science like Ayurveda. Then only you will understand. First you have faith in Ayurveda, then only you can treat your patients very well. Otherwise, if you are not having faith in Ayurveda, then definitely it is very difficult to treat Ayurveda treatment. So first you sincerely work hard, go in depth, study well, then definitely you will be, in future you will be good practitioner, good academician, and good researcher. So many openings are there. So don't think we have no opening, think in that sense, and definitely wherever the work you hard, definitely your success will run behind you. Thank you.
Thank you, ma'am, for being with us and giving so much of importance information regarding Ayurveda. Once again, a heartfelt thank you, ma'am.